Antonio Facciorusso, full professor of gastroenterology at the University of Salento in Lecce, Italy. I'm pleased to provide an overview on our paper recently published in the journal Endoscopy entitled Comparative Efficacy and Safety of Endoscopic Treatments for Gastric Varices, a Systematic Review and Network Meta-Analysis. Bleeding from gastric varices represents a major life-threatening complication of liver cirrhosis, and it is associated with high mortality and morbidity rates. Management of bleeding from gastric varices may be challenging and requires adequate technical expertise. Conventional treatment of gastric varices implying the injection of glue via standard gastroscopy shows favorable hemostasis rates, but it has been associated with adverse events such as pulmonary embolization, bleeding, and fever, and carries the risk to damage the working channel of the endoscope. Recently, EUS was used to guide the glue injection, enabling a more precise targeting of the feeding vessel of the gastric varix, with less amount of glue needed to achieve complete obliteration, and the direct visual confirmation of the obliteration of the varix via Doppler imaging after the procedure. On the other hand, the EUS-guided deployment of embolization coils within gastric varices was found to be a valuable alternative associated with fewer adverse events, but with uncertain success rates and higher cost. We decided so to conduct a systematic review and network meta-analysis of only randomized controlled trials comparing the different endoscopic interventions in this field. We also used the GRADE criteria for network meta-analysis to appraise the quality of evidence. Primary outcome was the rebleeding rate. In studies with less than 6 months of follow-up, the corresponding authors were contacted directly to retrieve longer-term follow-up data in order to minimize the heterogeneity. A secondary outcome was the rate of complete obliteration of gastric varices. All adverse events related to the endoscopic treatments were also analyzed. We finally included 10 randomized controlled trials in the network meta-analysis. EUS-guided glue and EUS-guided glue plus coil injection were associated to significantly inferior rebleeding rates than direct endoscopic glue injection. None of the other comparisons showed significant differences. Therefore, EUS-guided glue plus coil injection followed by EUS-guided glue injection showed the highest sucra score to prevent rebleeding. The sensitivity analysis restricted to the rebleeding rates assessed just at 6 months confirmed these results. All EUS-guided interventions were associated to significantly inferior rebleeding rates as compared to direct glue injection. Only EUS-guided glue injection appears significantly superior to direct endoscopic glue injection to prevent the rebleeding in the prophylactic setting, so not in active bleeding. None of the treatment resulted significantly superior to the comparators in terms of complete obliteration of the gastric varices. The analysis of adverse events showed EUS-guided glue injection, large volume bone ligation, and thrombin injection were associated to lower adverse event rates in comparison to the other treatment. Most frequent adverse events registered in the randomized trials were ulcer at injection site, fever, and abdominal pain, and most of these events were mild. The quality of evidence was mainly judged as low due to the risk of imprecision and risk of bias in the literature. There are certain limitations related to both the network meta-analysis as well as individual included studies, which merit further discussion. First, the paucity of direct head-to-head trials for certain comparisons and the limited sample size of the studies downgraded the quality of evidence. Second, network meta-analysis may be subject to misinterpretation due to conceptual heterogeneity related to considerable differences in participants, interventions, co-interventions, background treatment, and outcome assessment. However, in spite of this limitation, this manuscript represents the first network meta-analysis of only randomized trials comparing different endoscopic treatment for the management of gastric varices. We observed that EUS-guided intervention were associated to lower rebleeding and adverse event rates, although these complex procedures are currently available mainly in high-volume centers and require a long learning curve to achieve the proficiency. Thrombin injection constitutes a safe and easier approach, but with higher rates of rebleeding, whereas the direct endoscopic glue injection seems to be associated to higher rates of rebleeding and mild adverse events, although the very low quality of evidence requires further randomized trial to confirm these results.